This is Going Under, Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh, and we are brought to you by the Butterfly Network.
All right, I'm going to let you in on something that's completely changed the way I practice. I've been using Butterfly probes for years. It's a portable ultrasound that plugs right into my compatible smartphone or tablet, so I can start scanning at the bedside in seconds. If you've used the older versions, or even if you're new to handheld ultrasound, let me tell you why this new IQ3 is impressive and really a game changer. First off, having an ultrasound that literally fits in my pocket means I can move faster, whether it's vascular access, procedural guidance, or just getting real-time insights from my patients. And the tech inside this tiny device is pretty incredible. The biplane imaging setting lets me see short and long axis views simultaneously, which is huge for procedural guidance and great for learners as well. The new needle out of plane preset even shifts the scan plane digitally so I can see the needle tip sooner, which makes a real difference when precision matters. And the image quality, honestly, the IQ3 is as good or better than any of the cart-based systems at a fraction of the price. That's impressive for something this portable. If you're looking for a device that supports your practice, I can't recommend the Butterfly IQ3 enough. And right now, they're running a special offer. You can get $750 off the latest IQ3. Check it out at butterflynetwork.com.
All right, today we're talking about the government shutdown.
That's right.
And how it's affecting medicine in general and specifically anesthesia, of course. And a lot of times, Brian, when there's a government shutdown, it's because of budget disagreements. It's because of key political issues that are happening. Why now? Why now?
Oh, you know, we're so thrilled with our government officials. They're doing such a great job that, you know, it's all a political stunt. But you know, anyway, we're staying out of the political.
We're staying out of the political ring.
It's annoying overall. So I guess from our perspective, so we probably have to describe. So what's happening? So the House passed a budget resolution bill to continue funding the government because technically you're not supposed to fund the government if you're running a deficit, and we're always running a deficit because we spend more money than we bring in as a federal government. So the House passed the bill, but in the Senate, they don't have enough to bring it to cloture, which means you have to have 60 votes to get something even to the floor to vote on it. So they don't have enough votes to get to cloture, so they're not going to be able to pass the bill unless some Democrats side with the Republicans, excuse me, and pass the bill. Now they've called it, and I'm not a big political guy. This is just what I've been listening to. You know, from all the different sources, they call this a clean bill, a clean continuing resolution, CR, meaning that there's nothing different in this bill than there was the last time they almost didn't fund the government, which was, I don't know, 6 months ago or something like that. So there's zero changes from then to now. So again, big political stunt, and everything I'm hearing from basically all sources on all sides is that the first checks that won't go out would not go out by the 15th of the month. So everybody's expecting them the 15th
this coming
of October.
paycheck.
Yeah, correct. So everybody's expecting them by the 13th or 14th to get it done.
And if they don't,
well, then checks don't go out.
So one of the biggest things as we're recording this, we're about a week in to the shutdown, and people haven't been noticing. You do a lot of air travel.
Yep.
People haven't been noticing right now because, again, they're not a paycheck into this.
Yep.
But if you start getting past the 13th, 14th, 15th, and people
start getting furloughed at that point, yeah.
Right. You're going to expect massive layoffs, right? How is this going to affect? You do a lot of air travel.
Well, it's already bad. I'm sure it'll just make it worse. So, I don't know. I mean, it's TSA. Is that going to be affected? I didn't even look at that. Oh,
right. Any government worker that is part of that. I mean, TSA is already
understaffed.
Yeah.
Especially at South Bend Airport, where you try to leave at 6 o'clock in the morning, and every airline has a flight out at 6 o'clock in the morning, and they have one open lane.
You know they do that on purpose.
To piss you off or what?
No, because everybody's working at that time. So they have the shifts, right? So like so if you go to O'Hare International, and you're coming in from international flight, like we did this 2 weeks ago.
Yeah, fine, sure.
Came in from Germany.
Yeah.
Right? You get to O'Hare, you get to the line, and there's like a billion people.
But nobody checking anybody in.
getting there at the same time. All these flights are arriving at the same time. Why do they do that?
Yeah.
Because they want to funnel everybody while the staff is working those hours. That's what I truly believe, right?
Right. But here's the problem at South Bend is they only open one of the scanners. They have 7 people running around doing whatever.
We have 2 scanners.
Right, but they only open one of the 2 scanners, even though every airline has a flight that leaves between 5:30 a.m. and 7 a.m. And there's 1 scanner open.
But there's 8 people just standing around?
Standing around, yes, correct. So I'm not sure it could get much worse. I mean, I guess there could just be nobody at TSA, and that would be worse. But.
Well, at what point does this affect our mail delivery system? At what point does it, package delivery system, right? Like, I mean, people are going to lose jobs if we keep this sort of situation happening. Now, with all that being said, how does that affect medicine?
Sure.
Other than shipments, drugs coming in and out, pharmaceuticals.
There's a whole bunch of things. So the biggest overarching issue is that the IT department and Medicare is getting furloughed. So everything processing is delayed. So people aren't going to get their Medicare payment. Facilities and providers aren't going to get their Medicare payments.
Okay.
That's the biggest issue. And most of the providers in the country count on Medicare as a huge portion of their revenue. So, for instance, in anesthesia, we, probably in general about half Medicare. So all those payments don't come to us. They're getting held up in processing because they furloughed the IT people in the CMS.
When it gets resolved, because at some point this is going to get resolved.
Yeah. You get that money.
Right.
Yeah.
It's just back paid.
Yeah.
Right.
Yeah. It's just delayed. But still, you're talking about
people's livelihoods.
Right. You've already got limited cash on hand, so you're going to have to float that 15 days or 30 days or however long it takes.
And how do you expect to explain that to the mortgage companies?
Oh, sure. Yeah. I mean,
or whatever, right? Like
all the vendors that are bringing you stuff. Yeah. Yep.
How do you explain that to them?
Yeah. Yeah. So, and then here's the other issue is that facilities aren't getting paid by Medicare either. Most of the revenue that anesthesia companies generate comes from facilities paying them a subsidy. We've talked about this before, the models that we use.
Yeah.
We don't generate enough in anesthesia to pay for our services, so the facilities kick in. Well, if we aren't collecting Medicare, there's a higher amount that the facilities have to kick in, and the facilities aren't collecting their Medicare either. So there's going to be a shortfall of money.
So, I mean, as this falls to the wayside, right, what is being done about it? What is being done by nothing?
Nothing. They're sitting around fighting. They're still getting paid, though, of course. The congressmen and senators.
Correct.
They're still getting paid. Mm-hmm.
Which is a little...
Yeah. Mm-hmm.
I'm just questioning it.
Yeah.
We're not getting into the political ring.
I'm more than questioning it. They shouldn't get paid. If they're going to shut the government down, they should take no salary.
But they still are receiving salary
of course
while all this is going on.
Yeah.
Do you think it's going to be resolved?
I think so.
And if before the 15th, before this next paycheck goes out?
That's everything I'm hearing on it, yeah, from all the different sources that I read.
So, have things like this happened before? Obviously, government shutdowns have happened before, but has it affected the medical industry before?
Yeah, I mean, the Medicare thing happens every time they shut down the government, so that's not surprising. There were a couple of things in there. So telehealth. Mm-hmm. So this bill takes away the payments for telehealth that were instituted in during COVID. So they really increased the amount of telehealth you could do, how much they paid for it, all that sort of stuff. Even in anesthesia, we could even bill telehealth. So if I put a nerve catheter in, I could call and get telehealth reimbursement. That sort of disappeared pretty quickly from anesthesia. But what I'm seeing, so I mean, I'm a patient too, right? So I have a primary care doc who mostly does functional medicine, but also takes insurance, and they're no longer doing any telehealth visits.
That's interesting. I've noticed that about a lot of providers.
And just in the last couple weeks. Yeah.
They're not doing it anymore.
Correct, because they don't get reimbursed for it anymore. That was something that came out of the bill as well. Now, you can argue the benefits and as with anything, there were probably benefits to telehealth, right, and getting reimbursed for telehealth, but it was being abused because you could get paid almost the same amount for doing telehealth as you could for an in-person visit.
Is telehealth in general a good thing?
For some things, yes.
Or do you think it was kind of one of those niche things we'll look back on in 25 years and be like, well, that was a COVID thing, and we don't really need, we didn't really need it anymore?
Well, so I'm a big access guy, right? So how do we get more access to more people? So if you live in
telehealth,
right? If you live in middle of nowhere, Louisiana, and you can't get to a physician, but you have internet, you can have a discussion with them and get whatever you need taken care of via telehealth. There are some things that can be taken care of via telehealth. Is it the end all be all? No. Now with AI, maybe it is, right? Maybe you let your AI bot on your computer do an exam on you and tell you what's wrong or whatever. But I don't think it's the end all be all. I think there's still a place for in-person visits, but I think it's helpful.
I think we need to re-examine this AI conversation that we have, because I think there's a lot of things that I've been thinking about. Now we're kind of off the government shutdown topic,
okay,
but no, we'll get back to it. I'm kind of going on a tangent here, but there is a lot of things with this AI that I have questions about, and it has to do with telehealth, right?
Okay.
So, you're right. More access to more people. If you remember our previous conversations with those that we had at the Butterfly Conference.
Yeah, access is big.
Access is huge.
Yeah.
The doctor that we talked to in England, he's trying to get more access,
Huge,
right?
Exactly.
So if you're cutting down the telehealth visits, what are you doing? Are hospital systems, and again, this can be a conversation for another day, but just thinking about this, could hospital systems be coming up with their own AI
Oh, I'm sure.
instrument to send out to more people to self-diagnose? You know what I'm saying? Even though you don't want to self-diagnose, and people are already self-diagnosing, but is there an instrument that these companies
could help? Yeah. So
But if you're not having telehealth, and if you're always referring things back to the payment system, how does this work in that whole scope of the payment system?
So them eliminating the payments for telehealth, they never said you can't do telehealth. They just said we won't pay for it. So I think.
But who wants to take a loss on that?
Exactly. So some people still do telehealth because it's the right thing to do. But
But they won't pay the hospital system, or they won't pay the provider?
Both. They won't pay either.
So nobody's paying. So if you take a telehealth visit right now, nobody is going to pay you for that 45 minutes that you're...
Medicare, yeah.
Medicare won't pay.
Yeah. The private insurance companies haven't followed suit yet, but they almost always do.
So that'll be dropping down the line
point,
too.
Yeah, correct.
Gotcha. Okay. So they won't be getting paid at all for the telehealth.
Correct.
visits.
Yeah. So you can do it. That's what the government always says. Yeah, you're welcome to do whatever you think is medically
But you're not getting
necessary.
reimbursed for
We're
it.
just not going to pay you for it, right? Use your medical judgment, because I'm the one on the hook. If I don't do something because I'm not getting paid for it and a patient has a bad outcome, you think the government's the one on the hook for that? No, I am.
So what about concierge medicine?
Yeah. So if you're doing cash, then you just do cash for telehealth visits.
If you want to.
If you want to, right.
If you want to.
But so, I think if you build out the AI infrastructure to do telehealth visits, I'm sure that there are plenty of bots out there that you could literally you can see how glasses look on you. You can see what something looks like in your room at home before you buy it. I'm sure there's AI bots out there that can look at you, diagnose and then determine a likely treatment that then gets reviewed by a provider of some sort.
Well, we went a little off tangent. We're talking about the government shutdown, and how it's affecting medicine, and that kind of spiraled into this whole conversation. But I do want to say, this is as of 20 minutes ago.
Yeah.
The swing vote, Senate Democrats holding firm in the shutdown standoff.
Yeah. They got another week, though.
Right.
Yeah.
So, what are they just going to... if they know they're going to come to an agreement in a week...
It's political theater. It's just posing.
For sure is. Yeah. No signs of backing away from their hardline stance of withholding votes from a bill to fund the government through late November, insisting the public opinion is on their side, even though the shutdown stretches into a second week. And Tim Kaine, who is obviously the Virginia Democrat, says, quote unquote, nobody likes a shutdown.
He was an interesting guy. Do you remember him with Hillary Clinton?
Yes,
in 2016?
I do.
Yeah, he was interesting.
And then Gary Peters,
A lot of yelling.
he said, well, quote unquote, healthcare is still an issue that hasn't gone away, and that people will see very large increases in their premiums once enrollment begins next month.
Yeah, I don't know how those two connect, and maybe I don't know enough about the bill, but I'm not sure why they would see increases in their premiums. I mean, the cuts in the health side was telehealth,
right?
And then there were some specifics about who could be on Medicare and Medicaid, who could get SNAP, and we won't get into the politics of that because there's a lot of politics, and the way that it's written can be interpreted a lot of different ways. But I don't think that I don't see any reason why
premiums would go up.
That doesn't make any sense.
Well,
So,
hopefully not.
I mean, as a lot of this is just fear mongering, right? And both sides do this. It's just
Threatening one thing and
Yeah,
just saying this is going to happen and this is not going to happen.
Well, and if you yell something loud enough and enough times, they think it makes it true, right? It's just the echo chamber nonsense. But so the other things that'll happen with this government shutdown. So there's a freeze on funding and approval of new devices and new medications.
Okay.
So I don't know what's in the pipeline and if there's anything that was like going to come out right now. I don't dig deep enough into that literature, but
So
if there was either a medical device or a pharmaceutical, and this is
that
big
was
in anesthesia,
funded by the government.
well, no, so it has to go through approvals. So there's approvals in the FDA for medications.
Correct.
And then, I can't remember what the medical devices go through, but so all those approvals are on hold. So if something was in the pipeline to be approved, and let's say it was going to be approved yesterday, that's on hold because they aren't paying for the people who would do that. So if maybe we're missing out on a couple of weeks or however long the shutdown takes of a new medication or a new medical device. So, that's maybe theoretical, right? Does it really matter that this device or this medication is going to be delayed a couple of weeks? Probably not.
Right.
But that is something that's going to affect things. The other thing, though, is suppliers. So a lot of the suppliers get a lot of their funding and approvals and all that kind of stuff. There's a lot of government regulation that goes into suppliers. So you're talking about things like medications that are already out that you ordered and need to get in to do anesthesia, IV fluids, IV catheters, all kinds of stuff. There may be some delays in that. Now that will directly affect our ability to provide care. That's a fairly big deal.
So not good.
I mean, overall, a government shutdown is not good.
Nobody likes a government shutdown.
Nobody likes a government shutdown, with the exception of they're not spending our money wildly and without any.
So, but you think
hesitation.
there is kind of there is judgment ahead before they let this get too out of hand.
I mean, that would be the smart thing to do, right? To really have the government shut down and everybody feel that pain. Neither side really wants that, right?
Don't they have to travel?
Well, yeah, but private jets, I'm sure, but they're still paying themselves. Right. So I would argue, and again, this isn't really political, but it's more just rational, that if you're shutting down the government, like if I shut down the OR in my hospital and it was up to me and I said, no, we're shutting down, you're not having anesthesia, I probably shouldn't get paid for that, right?
I would assume not.
Right. So if they're the ones making the decision, we're shutting down the government, then they shouldn't be paid.
When there's when there's a shutdown with the NFL labor agreement,
right?
Or
nobody gets paid.
Nobody gets paid. Right? So, I mean, it's just the way it is.
Yeah.
It's just interesting, I mean, like nobody really saw this. I mean,
there's always a looming threat of government shutdown.
There is,
because we constantly do deficit spending. We haven't had a balanced budget since Bill Clinton was president. 96, I think, 95, 96. Newt Gingrich was the House Speaker, and Clinton was the president. We had a balanced budget, no deficit. So
will that happen again?
No. Our deficit's
$3 trillion.
Well, that's the
$6 trillion.
That's not the deficit. I think our deficit spending is like $900 billion. The
only
debt is 36 trillion or 38 trillion or something like that.
Yeah, that went up there.
Yeah.
That escalated quickly, as the kids like to say.
Actually,
you don't need to be a genius. Actually,
yeah.
Man, it's crazy.
So I think there's going to be a decent amount of pain, at least for these couple of weeks. We'll see what happens and whether they extend it, but there'll be a decent amount of pain in general in medicine. And then I think in anesthesia too. I mean, it's just anytime, we had that whole Change Healthcare where Change Healthcare went down, and that was probably 2.5 months of minimal or no revenue. But, this is even trying to deal with 2 to 4 weeks of no Medicare revenue is crushing.
As we go into the final quarter of 2025, speak fiscally and speak in general terms, what grade would you give medicine in general in 2025? How do you think the health of medicine is doing in America today? That's what I mean by that. Like, give medicine in general a grade. Do you think it had a good year? Do you think it had a bad year? Do you think it's as we go into the final quarter?
So right now in America, you are able to receive the best care ever. If you have any sort of illness, there is somebody out there that you can find in the United States that can treat you. So, I mean, if you're talking about in America, you getting care, I think we have the best care anywhere now,
that we've ever had.
Yeah, and it just keeps getting better because there's more innovation and all that kind of stuff. So, but then are you asking me the state? If you're asking me the state of medicine as an industry, as a business, it keeps getting worse. I mean, we were talking about this. I can't remember who I was talking to about this today.
That's an interesting dichotomy, though.
Yeah. So private equity is a huge part of that venture capital, where they're going in and buying in practices and driving down innovation, driving down reimbursements, and then increasing their own profits. So that's a huge issue. And I think we continue to make dumb rules, and we continue to drive down. Although in 2026, we're getting an increase for the first time in a while. Medicare is not giving us a cut, so that'll be good. But we're getting an increase on the Medicare rates. But I think there are too many hands in the pot in medicine. Too many people taking...
Because there's money to be made?
Because it's 1/6 of our GDP. Yeah, there's all kinds of money. I mean, you've got... I'm trying to remember what the statistic is. I think we talked about this before. You look at the amount of spending in medicine, and over 92% is non-clinical care. Administrators, government regulations, all kinds of stuff like that.
We have talked about this before.
92%. So if you took out every clinician practicing medicine, you took away the entire ability of the medical industry, what's the defense kind? What is it called? Like the medical industry in general, whole thing. Nobody was actually seeing a patient. You would only save 8%. That's the bloat in it, right? Because there's so much money. So every time you got an additional administrator and this and that and this and that, and everybody's taking a little bit of money out of the pot. That's why it's so expensive. I mean, that's a huge part of it.
What is the biggest percentage you think in that pot?
Administrators, 100%. It's like 10-1 administrators to clinicians. It's ridiculous, and they all are highly paid. Not all, but you get to a certain level,
well
highly paid. They make way more money than most even surgical physicians.
Wow.
So, they're all 7 figures. CEOs of hospitals and stuff. It's a big waste of money.
I love this conversation. Yeah. I mean, we do have to talk more about these topics as the season and the series goes along, because I think it's important, and bring people on. I mean, I know we had plans to bring some guests on this season.
Yeah.
But it's really interesting.
So you're in the newsroom. What are you hearing about the government shutdown?
Funny enough, nobody's really talking about the government shutdown.
Okay, interesting.
It's all about, there's a government shutdown happening. It's news.
Yeah.
Okay, well, how does it affect your daily life?
Yeah, why? You know what I mean? That? Like even local news, you should be talking about that.
I mean, we are talking about it. And actually, Senator Braun is stopping by the studio tomorrow to talk about AI.
You know where he's from? Jasper.
Is he really?
Yeah.
Ah.
And he's governor now, isn't he?
Yeah.
Yeah. You said senator.
Oh, I'm sorry.
He's Governor Braun.
I'm sorry. That was my mistake.
Yeah.
I knew him when he was senator, too.
He's from Jasper, where my family's from.
That's interesting.
Yeah.
So Governor Braun,
apologies
on that. He is stopping by tomorrow to talk about AI.
Okay.
Might be interesting to talk to him about the government shutdown, too.
Yeah, you should.
So you just don't really, in our newsroom at the moment, there's not really a we are talking about it.
Well, nobody's felt much pain.
Correct.
Yet, right? Like that's the issue.
And I think the biggest thing on everybody's radar right now is air travel. How is air travel going to be? I mean, that's what all the news reporters are talking about, right? They're talking about the government shutdown, and if you're in Capitol Hill, you're talking about the shutdown and like what the senators are doing and what the Dems are doing, what the GOP is doing, You're not really talking in depth about that in the newsroom. You're talking about, hey, is my mail going to come?
Yeah.
Like when I go to TSA, are there going to be long lines?
Will there be anybody there?
When I fly out, is there going to be anybody there working there?
Actually, it might be better. Just free reign. Just let everybody run in. I like it.
It's going to be how it was 40 years ago. Just did whatever you want.
Well, you used to be able to, I used to carry a pocket knife, and they would have you pull the pocket knife out and make sure that it wasn't longer than the length of your palm.
Yeah.
And then they let you on the plane with a pocket knife.
They didn't even have security before.
I mean, they did, but they just...
I mean, my family's from Madison, Wisconsin.
Yeah.
There was a Dane County Regional Airport.
Yeah.
I don't ever remember going through security. Like, if you were a family member, you would be able to walk in right up to the gate.
Oh, yeah.
See your loved one off. See your loved one get off the plane.
Oh, yeah.
There was no, you don't need
security.
a ticket
No.
security.
No, yeah.
I mean, and look how much it's changed over the last. So, I mean.
And to what end? Do you think we really prevented that many attacks or issues that would have occurred based on taking our shoes off and only having 3 ounces of liquid and all that kind of stuff?
There's a funny, if you ever watch Key and Peele, have you ever watched Key and Peele?
Uh-huh.
I'll send you a reel.
Okay.
It's very, very funny and pertinent to what we're talking about. I don't know, maybe, right? I mean, like, again, we're talking about ROI before, off the air. And what is the ROI of having TSA, right? Is it a way for them to get more money with Clear and TSA pre-check and
probably.
da-da-da-da-da?
Which, by the way, touchless, way to go.
I know.
Have you done that yet?
Yeah, it's good.
Yeah.
It's really good. This is how, so now we're off into travel tangents, but I'm going to tell you, the countries we went into, you want to talk about no security, by the way, Florence, Italy. Like there's zero, when you arrive from an other European.
Thanks for letting all the terrorists know. I appreciate that.
I hope our podcast is not
who knows
resonating, right?
We're all over the world.
So we are, but when you go into Florence, Italy, if you're coming from another European Union country, you don't need to go through an additional step once you land. If you are coming from somewhere else, you go through security. But the point is, I love how they do things in Europe, because if you've ever gone into Europe, they have passport control is all automated.
Oh, nice.
So it's basically, if you're from these countries, you go in. Japan is like that too. You scan your passport. They have your passport.
And they
open the gate.
Yeah.
You solo walk into this area. Yeah. And it's like it's clear so you can see. Then they do the facial recognition. Yeah. Then they go, whoop, approved, right through.
So this is funny. They tried to do this in Mexico when we were going.
Yeah, they have it in Mexico.
But it doesn't work.
Oh, it doesn't? No. Not for kids, it doesn't.
It doesn't work at all. The last 3 times.
On the far left.
Yeah, the last 3 times we've gone, you try to go in there and they're like, no, it doesn't work.
What?
I mean, come on. That Cancun airport?
Yeah. Cancun airport is interesting. It's interesting. I don't know. That's besides the point that we're getting at. I feel like we could do like
way 10, off. Yeah, we went way off.
I feel like we could do 10 podcasts on travel, but because we do it so much. But I'm saying, like, if we were to adopt something like that in the United States, I think it's great.
That would be helpful. Yeah.
That would be helpful. Things would go way faster. But again, you've seen the long lines in New York.
Oh yeah.
The TSA pre-check.
Yeah.
I mean, it's
crazy.
Need
touchless for sure.
We need touchless.
So
it'll be interesting to see if these things are affected over the next couple of weeks.
I'm going to be very unhappy because I have travel coming up. I really, really am going to be unhappy.
But that's America, though. I mean, no matter what you think, I think there's been this kind of, I don't know, let's say over the last 15 years, right? There has been this, I don't know if it's a stigma or if it's a thought process oh, like nobody's traveling anymore. It's expensive to do things. Have you ever gone to an airport? It's packed.
Yeah. Oh, yeah.
It is packed.
Yeah.
I'm sorry.
Yeah.
You're going to tell me nobody's traveling?
Everybody's
I went to
traveling.
Florence, and like you can't even walk through the streets. It's so packed. People are traveling.
Oh, 100%. Yeah.
They're spending money.
I think the inflation on travel has not kept up with the overall inflation. So I think people are making more money. And even though it's expensive to travel,
It is expensive to
the
travel.
cost of travel has not increased as much as wages have.
Correct.
So it's easier to travel. More people are able to travel because it's less expensive in relation to the amount of money they're making.
Which I like traveling, so
It's fine.
not when TSA is shut down, though.
So I'll do it as we close this out,
Yeah.
I assume. I will make a push that everybody reach out to their senators and get this thing finished and passed because it's not worth it for the pain that it could potentially cause. And like I said, it'll be a big, big issue for medicine.
Government shutdowns are always a pain. And to
Yeah.
quote Tim Kaine, nobody likes
likes
a
it.
government shutdown. All right. We'll end it there. We are... Huh?
Wasn't he the one who was like screaming on stage? I feel
No.
Like was that Walls?
No.
Who was the, I can't remember.
Please
the
don't
one
get
who
me
was
started on
screaming
walls. I've
stage.
lived in Minnesota for years.
Yeah.
You're talking about...
Kane.
Not... We're talking about... You're talking about the guy in 2004.
Yes.
Who was like, we're going to go to Iowa, and then we're going to go to Minnesota, and then we're going to win in a thing, and then woo! Yeah, that guy. I can't remember that guy's name. Comment below if you remember. I can't remember that guy's name. He literally ruined his entire political
Yes, he
career
did, just
in
by that.
2 seconds. Oh, the good old days.
I sounded like Ric Flair. Woo!
Woo! Well, this has been Going Under Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh. We are brought to you by the Butterfly Network. We'll see you in the next one.